Hi, I'm Dr Moratwe Masima, and I'm honored to present Profmed's Pink Room. This is a space dedicated to breast cancer awareness, support, and empowerment. To highlight breast cancer awareness, I will now be going into the different statistics both globally and nationally. Let's start with South Africa. According to the 2023 National Cancer Registry, breast cancer ranks top among South African women, followed by cervical cancer, then skin cancer, and lastly, colorectal cancer. 1 in 4 South Africans will be impacted by cancer, both directly or through a loved one. And lastly, breast cancer is known as the most invasive cancer in all South African women. Let's start with South Africa. Breast cancer is known as the most common kind of cancer in South African women. 1 in 4 South Africans will be affected by cancer, either directly or through a loved one. Lastly, according to the 2023 National Cancer Registry, breast cancer ranks top amongst all cancers, followed by cervical cancer, and then skin cancer, and lastly, colorectal cancer. Let's shift our focus onto the global statistics. About 1 in 8 women in the United States will experience invasive breast carcinoma. Less than 1% of men are diagnosed with breast cancer. And less than 16% of people diagnosed with breast cancer in the United States are less than 50. Joining me in the conversation is Justine Lacy, who is a clinical executive at Profmed. She will be providing us with the healthcare perspective. On my right is Suraiya Nawab, who is a breast cancer survivor as well as a proud member of Profmed. Starting with Suraiya, I really just want to know from your perspective, what is the most difficult experience throughout your journey and why?
Okay, so for me, I think the most difficult time was the waiting between my fine needle biopsy to the prognosis and the treatment plan. Those 3 weeks just were torturous because you're just waiting and you're anxious and you just want to know what it is and you want to get on with it. So I think that was the most difficult part for me, the waiting. Once the treatment plan is there and you have some way of knowing that you're getting something done about it. You're not just sitting with waiting and waiting all the time. There's a process, and then if you start accepting that process, somehow the numbness goes away because you have things to do towards healing.
Yes.
So for me, the waiting period was probably the worst of the whole treatment.
Yeah, that can be one of the most scariest things. And I think that as a doctor, I do always have to remind myself that I'm not just treating the patient, I'm treating the whole person as well as their family members. And on that note, I really want to know from your perspective, how did your family react to the diagnosis, the news, and how did they support you during this time?
Okay, so I think my family, it was shock first. I was in denial, I think, at the beginning, and also just felt very numb, as I said. My family, my daughter and my sister are both medical doctors, so I think they didn't want to show me their concern.
Yeah.
But I overheard them speaking to each other about what it may be and what the diagnosis may be. So I think they were just very supportive. My husband is soft-natured, so he actually was in more denial than I was, I think, because it was just, the results may be different. Let's go for a second opinion. We can't just accept this. So he was looking at trying to deny the diagnosis, I think. For me, I think being a wellness practitioner myself, I think I had to remind myself that I'm a person now, and a patient now, and I need to just allow things to flow so that I can ease into the new reality for me in my life. So yes, lots of friends and family support. Immediate family was really amazing.
Yes.
And I think you need that. No matter how strong your personality is, you need to know that you can count on people, because it's actually a whole shift in your lifestyle immediately.
Yes.
And so to try and absorb all of that, it's good to have comforting people around you and helpful people, as long as it's not too overwhelming. Because if you've been an independent person yourself, doing everything yourself, working, having to do whatever you need to do, you realize that all this is probably going to end for a little while at least. And so I had to focus on now taking care of myself and the healing. And that shift is also a bit difficult in your head, because your life is never going to be normal until your treatment is over. So also to have the family members to tell you, don't worry, we're around, we're here for you. In the beginning, that was a good support system, and I think we all need that.
Yes.
So yeah, that was important.
That's really beautiful because a lot of people don't actually have that support system. And I actually want to touch on that with Justine. So being a medical doctor, I work in both the government sector as well as the private, and I see the big disparities. From your perspective and the healthcare perspective, what do you think are the barriers to access for women in South Africa to get breast cancer screening?
So, Dr. M, if we're looking at the public sector, which I assume is what you are specifically referring to, members who are based in rural areas, sorry, not members, people who are based in rural areas, I think that I could probably pinpoint at least 3 important barriers, which should not be overlooked and just seem to come up year in and year out. And that would be specifically, I think, barriers in terms of language, where English is not everybody's first language. So I think it's so important that if you're communicating with women in the rural area, that you understand what language is best to convey the education and awareness in. And then in terms of access, I think that's also quite an important thing. It's a barrier that means that women don't perhaps have the type of access to actually get tested. And that's why we see such poor levels of testing, volumes of testing, because women just simply don't have access to community clinics. They live too far and they can't afford the transport to get there. And then I think the third important point in terms of barriers would be in terms of education. And I don't really necessarily like the word education, let's say rather empowerment. A lack of empowerment because of a lack of information in terms of the importance of early detection, the importance of doing a regular screening. And people don't seem to understand the importance of those aspects, and hence are just simply unaware and not sufficiently motivated to get the necessary screening done.
Yes, I would say, just to touch on that, I have experienced a lot of patients coming back to me saying that they've come back to the clinic because once I refer them to a higher level of care, like a tertiary hospital, the waiting times are so long. And it is quite discouraging for patients to be told you have to wait 6 months to get a scan. You can only get the specific medication after a specific period of time. And by that time, the cancer has spread. And I think that's the biggest thing that I see. Obviously, for the people that are privileged enough to be on private medical care, the process is sped up much more faster. But I think what is important today is to really put the power back into people's hands, to teach them how to do the breast examination so that they can get to the higher level of care, and just empower people, as what you mentioned before. Empowerment is very important.
Absolutely. And I can't emphasize the importance of early detection enough. I know that all 3 of us would agree on that. As I've indicated in previous media interviews, the earlier one detects, in this case, breast cancer, the less of an impact it has on your psyche and your and physically, not to mention economically, because it's actually a whole lot more cost effective to treat early breast cancer as opposed to having it diagnosed at a much later stage.
Definitely. I want to go back to Suraiya. You basically mentioned that you had to take care of yourself. You had to learn how to take care of yourself and almost carry yourself through this journey. What were the different practices that you did to help you ground yourself?
Okay, so for me, I think the first thing is that gratefulness, just taking from Justine's answer now and what you, Dr. M mentioned, I felt so grateful and blessed that I was privileged to be a member of a medical aid, to get to the treatment as soon as possible, to get the doctors that we need to be going to. And so I think it was just complete gratefulness first, that I could get all this done so quickly, and get the diagnosis and then the treatment after 3 weeks it started. So I think that for me was very important. The other things that I think help a lot are, grief is not only about death and dying. Grief is also about a loss of anything. In my case, being diagnosed with breast cancer was a loss of my independence as a person, a loss of possibly a job. I was just very lucky that my employers took it were very kind and considerate and said, you take off as much time as you need during your chemotherapy and things like that. And so in that way too, I felt really blessed. So, but it's that feeling of you're not going to manage anymore. And so you have to start grounding yourself, as you said. So prayer was a big thing for me. Also finding some quiet time. I'm normally a very talkative person. So I realized that I just need to be a bit quiet and just sit with my own thoughts and allow those thoughts to actually just heal me also inside. Some sense of privacy, I think, was important in terms of visitors and people with noble intention that will come over and see you. But my kids, who were young adults by then, decided that they're going to bring people to my room if I'm really out, knocked out of my senses with the chemotherapy for those few days.
Yes.
Come and peep and say, are you okay? And leave. So I think that sort of being able to navigate it that way makes it a lot easier. I was never expected to sit with guests or be anywhere available for everybody. So everybody just gave me that time, and I think I appreciated that a lot. The other thing for me is that relationships change, especially your close relationships. You change your relationship with your spouse. You start prioritizing differently. You actually look at your value system and your belief system, and you think about how that can change in terms of just a clinical diagnosis and illness like this. I think the C word, still, with all the information that we have and awareness, is still known as or seen as a death sentence. And so people immediately, when they hear that, everybody just sort of turns away from you, or steps back from you rather. And I think all of that changes your value of your life, as I said, your value system, your belief system in the fact that healing comes from above. There is a sense of somebody that will care for you and look after you, and I'm thinking of a higher power in terms of spirituality.
Yes.
And then I coined this phrase for me, and I think it just says so much. For me, it was, if he brings you to it, he will take you through it.
Yes.
So I think that sense of there is a higher power that's looking after me was a very much more of a grounding for me. Having the time with loved ones, I used the time to set special boundaries for my own family. I had a little 2-year-old granddaughter, who was my first granddaughter, and she was just my life at that time. And so if I was feeling a bit sad, I'd get her to come and sit on my bed. And so I think patients need to find their own ways of grounding themselves. But I think it's very empowering, to use the word again. It's very empowering when you do that, because you're, in a sense, also taking care of yourself. Again, coming from a privileged background, which I'm ever grateful for, I could leave everything and just concentrate on my health and wellness and getting through the treatment.
Yes.
So I know many people don't have that opportunity, and then I think caregivers can play a big part in allowing the patient to just accept the diagnosis and then go through the treatment, because I think the diagnosis is just the first part. It's the treatment really that is so taxing on you, on your emotional self, your physical self. And so I think you need to keep on demanding yourself that you need to get through this. So I think self-talk and self-compassion is important, I think, as well.
And perhaps I could just add, enhance what Suraiya said in terms of, I just noted at the beginning of what you were saying, Suraiya, in that your loved ones and your friends, some of them tended to step away or distance themselves from you. And I'm sure that was not out of a lack of love for you, but just simply because they didn't know what to say or how to react.
Yeah.
And so desperately wanted to contribute and support you, but simply didn't know how.
Yeah. Yes. Yeah. And I was coming there because that's so important for me, is that I still think that's why these sort of programs or awareness campaigns are so important, because I think there just isn't enough awareness.
Yeah.
And so people don't know how to react to you.
Yes.
So they would rather react by moving away and not respond with being caring or being, and they're there, they come, they'll call you, they'll drop off a pot of food, they'll do all these things, and it's just, I think it's pure ignorance of actually what, and that C word is just too big for everybody.
Yes, it's overwhelming.
Yeah, and if we look at and we look at Dr. M's introduction in terms of the statistics, then we know how prevalent breast cancer is for all women in South Africa. And so I think when we're just cognizant of that, then it was for me, it was learning experience for me, but also teaching experience to others.
Yes.
To see how you go through this and awareness. And now I look at people who are diagnosed with cancer, and especially breast cancer, by any really terminal illness, very differently, because it's only when you're right there, and we spoke about this earlier, that you can actually empathize to that level. So I think people mean very well. They just don't know how to react.
Yeah.
For example, when I used to have people come over, and if we were sitting together, if I was well enough to sit amongst visitors that came, they'll start speaking to you, but they won't make eye contact.
Yes. Yeah.
Because I think it's too difficult for them to make that eye contact, but they just want to be present. At some points, I actually felt like I had like an out-of-body experience, because people started having their own conversations, and then you're sitting here and you're almost listening to it. And I don't think people mean it, as Justine says. I think it's just they wanted to lighten the moment for me, basically, that we're all together, but they sort of don't engage directly with you. So I think it's just normal behavior and responses of people. But I think the awareness needs to really go out so that...
Yes. So perhaps, Dr. M, I mean, I think what I was getting at was the fact that when there is a cancer diagnosis, or any type of diagnosis for that matter, it's often the family that are left out of the equation.
Yes.
All the focus is on the patient or the member in terms of their treatment, and rightly so. There should be a lot of focus there. But it's the loved ones need to be included in that conversation.
Yes.
And they also need to be guided in terms of how they can support the patient and how they can look after themselves in the process as well. Because it does have a knock-on effect, especially if it's somebody you love very deeply and you're very close to. It has a knock-on effect on the psyche of everybody around them.
It does. Yes.
And with people stepping back, it's simply... It's not just ignorance, but it's simply the fact that they do not know how they can support that person. So they need to be guided and supported just as much as the patient.
Yeah, this is true. And I wanted to actually ask on that point, are there any structures, even from a medical aid point of view, for the family members
just to provide that level of support, counseling? Do they?
Absolutely.
Yes. Do they have support groups?
Yes, and I think it's very important from a medical scheme perspective that whoever's managing that member or assisting them, and that they listen very carefully to what that member's needs are, and that they're empathic towards the member at every point. Just maybe not necessarily understand from a personal perspective, but trying to understand how that member's coming to terms with their diagnosis.
Yes.
And further than that, just trying to navigate the complexities within the medical scheme environment. So it is a matter of directing the member to benefits that are going to support the member in terms of counseling and oncology benefits for their treatment. And Profmed does have a rich set of benefits when it comes to counseling. We have therapy benefits. I don't want to say psychiatric, let's say mental health benefits, because mental health support is just as important as the physical aspects of the disease, because I think a lot of the focus is on the treatment of the physical disease.
Yes.
And the mental health aspects are actually neglected. So from an emotional, psychological perspective, that needs just as much attention as the physical treatment that the member is getting. So we make it known to our oncology members that there are benefits available for them to see a therapist, to talk through their concerns, their fears, anxiety, depression, whatever might come up. But we often find, just through our research, that a lot of our members feel more comfortable speaking to somebody they know, while others feel more comfortable speaking to a stranger. So it's interesting, it's different dynamics for different people. The stranger will give you probably a more objective answer, or more objective view of things, and support. Whereas someone you know will be more subjective, I guess, in their approach. But yeah, I can't emphasize enough the importance of mental health in the whole equation.
Absolutely. Yes, I think people forget sometimes that your mental health is just as important as your physical. I've actually seen it in practice that a lot of patients show up with physical symptoms, even though it's actually a mental health disorder. Anxiety, depression can cause things like chronic headaches that never go away with treatment. And it's really important that we highlight that. I'm going to be asking the last question for both you ladies. I want you to give just one advice to somebody that may be starting out on this journey, maybe seeing that they're noticing a difference in their body. How do they go about it?
Okay, so for me, even when Justine was just talking just now, for me it's about embracing the process. So as a specialist mental health practitioner myself, for me, when I get patients that would come to me for the support or counseling, I'd say to them, don't fight the diagnosis or the treatment, embrace it. And I like that word, because to sit through 5 hours of chemotherapy on a trip, you need some resilience. And so that's advice I would give, trying, because I personally believe that when we accept and embrace that treatment, the body will respond to it rather than reacting.
Yes.
And I lived through that. So, and I really strongly believe in that. So that's the advice I'd give, is that keep the independence as much as you can, allow caregivers to help you, embrace the treatment, and try and find yourself resilient through the grounding and anything that will help you stay strong through it. So, yeah,
That's beautiful. Thank you. Yeah, that's really good. I think for me, I would emphasize the importance of staying connected, because I think when you get a diagnosis that you're coming to terms with, even after you've come to terms with it, just through the journey, one could tend to withdraw from everything that's happening around you. So it's a matter of, and I think it resonates with what Suraiya said, in that it's about staying connected with the people you love, and your creativity, finding things that calm you down,
Yes.
and just finding things in nature, your faith, staying connected to everything that will give you the strength to get through.
Yes, definitely. And I just want to highlight that people shouldn't be afraid to speak to their doctors or their healthcare practitioners. I think that even with myself, I am scared to go to my doctor sometimes, even though I am a doctor myself. But avoiding things doesn't actually help, it just delays it. So it's important to go to your doctor when necessary. I will now be moving on to the most important part, which is the self-breast examination, and we will be demonstrating how to do it.
Breast examination is a screening tool that you can implement at least once every month. For women that are still menstruating, you can do it on your menstrual cycle. And if you're not menstruating, just pick a date and stick to it. I'll now start with the examination. You need to ensure that you're standing in front of a mirror or lying on your bed. But for the sake of this video, I'll be showing you how to do it while standing in front of a mirror. The first thing you need to do is place your hands on top of your hips like this, and then look at both your breasts. Look for any symmetry changes, shape changes, or any color changes. It's important to check for any rashes, any dimpling of the skin, and any nipple discharge. This can range from pus coming out or even blood coming out of your nipples. From this position, we'll place your hands behind your head like this and use the tips of your fingers to feel for any changes in the breast tissue. Start at the outer aspect of the breast. As you make these small circular movements, you try to find any changes such as nodules or bumps in the breast tissue. This will alert you as to whether you need to go get checked up by a healthcare professional. Make sure as you go into the circular motions, you go all the way into the nipple so that you can feel for any changes in the breast like this. From here on, you're going under the armpit to feel for any swelling. This can be swollen lymph nodes and can also be a marker of any breast changes. Not all the changes actually mean breast cancer, but it's important to go get checked up because you never know. This video was proudly sponsored by Profmed. Profmed also provides benefits for preventative screening and encourages its members and society at large to take care of their health and go get screened. I hope you enjoyed this video and it was empowering to you.